Hello, this is the Nursing Student Challenge. Today we have 5 questions that are guaranteed to make you think a little bit. The topics are going to be oncology and end of life care. So I want you to grab a piece of paper so you can take some notes, keep track of your score. And if you like, please share them with us. Let us know how you did in the comment section. Okay, the first question is, a home health nurse is assessing a patient with limited mobility who lives alone. While the nurse is in the home, she notices that there's a lot of clutter, poor lighting, loose rugs. What action should the nurse take? Again, this is a select all that apply. So here are your choices. A, the nurse would want to assess the patient's fall risk using a standardized tool. B, recommend removing loose rugs and clutter. C, inform the patient to wear socks when using the cane. D, tell the patient they cannot live alone anymore. E, suggest installing grab bars in the bathroom. You have 10 seconds to come up with a correct answer. The answer is A, B, and E. You want to establish a floor plan. You want to get rid of all of the clutter and the rugs, and you certainly want to suggest grab bars in places where appropriate. Question number 2 is a multiple choice. And here is the question. A patient with amyotrophic lateral sclerosis, ALS, is experiencing difficulty swallowing. The patient is coughing during meals. What should the nurse do first? Here are your choices. A, encourage the patient to eat quickly. B, provide a straw for all liquids. C, place the patient on NPO, nothing by mouth. D, request a speech and swallowing evaluation. Again, you have 10 seconds to think of an answer. The correct answer is D. We want to request a speech and swallowing evaluation. We definitely don't want to encourage the patient to eat quicker. We don't want to give them a straw because that could promote aspiration. And we don't want to just arbitrarily place people on NPO until they're assessed. So the correct answer is to get a speech and swallowing evaluation. All right, question number 3 is also a multiple choice. And so hopefully everyone is understanding. If not, please, as I said, drop me a note in the comment bar and I will, in the comment section, and I will answer your question. Okay, a patient had a mastectomy with a lymph node removal on the right side 2 days ago. What action should the nurse avoid? Now we want to know not what the nurse will do, but what they will avoid. All right, so here are your choices. So A is assessing the surgical drain output. B, encouraging hand exercises on the right side. C, elevating the right arm on a pillow. D, taking a blood pressure in the right arm. All right, you have 10 seconds to pick the correct answer. The correct answer is D. You want to avoid taking blood pressures in the right arm on any patient who has had any sort of surgery in that arm or limb. You want to avoid any restrictive devices in that area unless otherwise specified by a doctor. All right, question number 4. We're almost at the end. So in this question, all right. So our patient had surgery. He or she is 5 days post-op following a colon resection with an ileostomy. The nurse notes that the ileostomy put out 1,800 mLs in the past 24 hours of watery drainage. The patient reports muscle weakness and dizziness when standing. The patient's heart rate is 96 beats per minute. The blood pressure is 118/76 with a baseline of 138/82. And he ate 75% of their meal yesterday. What should the nurse do next? A, Check the stoma for appearance and color. B, check capillary refill and skin turgor. C, check bowel sounds in all quadrants. Or D, check the surgical site for dehiscence. You have 10 seconds to select an answer. So in order to understand this question, you have to understand the objective and the subjective data. And then you have to know what's normal versus what's not normal during post-op, especially with someone who has had this type of procedure. So one of the things that's really important is the amount of fluid that's coming out of this ileostomy. We know that the patient said they ate well. There were no problems. We know that the ileostomy is functioning, is active. So our concern is now whether or not this patient is dehydrated because they are expelling a large amount of fluid and they also have a fever. So that's the one thing that we want to check for is dehydration. And if they are, notify the provider and get an order for fluids. All right, question number 5 is a drag and drop. So there'll be a question number 1 and a question number 2 following it. All right, so you'll see 2 boxes and I'll explain that to you. So our patient has acute myeloid leukemia, AML, and has the following labs. So the white blood cell count is 1,200, should be 4,500 to 11,000. The hemoglobin is 7.8, the normal is 12 to 16. The platelets are 18,000, normal is 150,000 to 400,000, and then the temperature is 101.8 Fahrenheit. So complete the sentence by selecting the drop-down list. The nurse recognizes that the patient is at greatest risk for developing blank based on blank. So the patient is at highest risk for developing blank based on blank. And here are your choices. Number 1, A, tumor lysis syndrome. B, anemia complication. C, hemorrhage. D, infection. Number 2, A, low white blood cell count. B, low hemoglobin. C, low platelet count. D, elevated temperature. All right, so you have 10 seconds to come up with an answer for 1 and 2. So the correct answer for 1 is D, infection, and the correct answer for 2 is D, elevated temperature. All right. Let's see how you folks are doing. So the rationale is that all the labs are low. However, the priority is an infection. And it's the priority is an infection because an infection can lead to sepsis. So how did you do? 5.5 is NCLEX ready. 5.4 is excellent. 3.5, great job. 2.5, keep practicing. 0 to 1.5, go back and do a review. Leave me a comment. Let me know how you did. Let me know what you'd like to review next. And I hope to see you. Please like, share, and subscribe. Thank you so much for joining me. And hopefully I will see you in my next trivial challenge and NCLEX support.